sponsored by the Carpal RX. Carpal tunnel syndrome is a condition that causes symptoms in the hand and fingers like pain, numbness, and tingling that are often debilitating. But what causes carpal tunnel syndrome? It's actually a disease that affects an area inside the wrist known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. Therefore, for any remedy to be effective and lasting, it must solve the problem of swelling inside your carpal tunnel and not just mask the pain it causes. The great majority of people who find themselves in pain from carpal tunnel syndrome reach for a splint or a brace to help them. Yet of the tens of millions of braces that are sold every year, most are used improperly or overused. For instance, most people think that a splint will allow them to work better, so they simply slap one on and go about their business. So they accumulate more and more splints thinking that the next one will work better. But they won't, because splints and braces should only be worn sparingly during the day and never while working. That's because you'll unconsciously fight the splint while you work, and that will produce even more damage inside your carpal tunnel. However, while we sleep, we unconsciously subject our wrists to tremendous bending forces, and splints and braces are perfect to protect against that. And this is why, if you have carpal tunnel syndrome, you should always wear a splint or brace to bed to keep from overbending your wrist. Many people with carpal tunnel syndrome wrongly believe that surgery is a cure for their condition, but all surgery does is remove the pressure on the median nerve. Swelling of the tendons can continue even after surgery. So as you see, surgery only relieves nerve compression. The tendons continue to swell even after the surgery, and it's the main reason why surgery usually fails. Surveys show that most patients who have carpal tunnel surgery are not satisfied with their results, but the vast majority of people who use non-surgical therapies are quite satisfied with their results. That statistic is so important that the Association of Orthopedic Surgeons and the National Institutes of Health, both of which regulate hand surgery, say that all patients should try all non-surgical options before considering surgery. Chief among the most effective non-surgical treatments is deep tissue massage of the wrist and forearm. It's nearly 100% effective in getting rid of carpal tunnel syndrome, but it must be done every day and for a period of 2 to 4 weeks. Anything less is ineffective. Now, this isn't your everyday ordinary massage. It requires specific motions over the wrist and forearm that, over time, drains excess fluid, which reduces swelling over the tendons, and reduced swelling alleviates carpal tunnel syndrome. So as you see, you don't need surgery for your carpal tunnel syndrome, nor do you have to bother with ineffective and sometimes dangerous splints and braces. Instead, deep tissue massage, applied daily, is nearly 100% effective in alleviating your symptoms. To get this professional therapy for your carpal tunnel syndrome or wrist tendonitis, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome or wrist tendonitis, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome or wrist tendonitis, except it treats you every day at a fraction of the cost of a therapist and in your own home. The Carpal RX is calibrated to produce the same motions and pressures a therapist uses to relieve your pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. So get rid of those splints and braces that just don't work. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.